Medicare will not survive long term without changes to make it sustainable today. The two reports that were commissioned by the Rudd and Gillard governments both said that health spending was unsustainable, and it is. We have put forward a plan which protects the most vulnerable and those that can't afford to pay to go to see a GP. We will always protect those people, but at the core of this policy is to ask for a modest co-payment for those Australians who can afford to do so that we can make Medicare sustainable, bearing in mind that Medicare today, we spend about $20 billion a year, but we raise $10 billion a year through the Medicare levy. So the government is determined to make sure that Medicare is sustainable. We are determined to send a price signal so that we can move away from the view that everything can be for free in health in this country, because it can't be. And thirdly, we are determined to see the Medical Research Future Fund funded in this country, because it will provide the cures and the new care plans and all of the investigations and research that we need to make sure that we can find those cures for a 21st century Australia. That is absolutely essential. So we will do whatever it takes to make Medicare sustainable. We call on the Labor Party to be responsible. Our negotiations obviously still continue with the independent senators, but we are determined as a government to make Medicare sustainable, and make it sustainable we will, because if we don't, with an ageing population, we will find ourselves in 10 or 20 years' time with a system that will collapse under its own weight, and that is why the government is determined to make sure that we have Medicare sustainable, that we can get money into the Medical Research Future Fund, and that we can send a price signal and ask for people to make a modest contribution wherever that is possible, whilst at the same time always taking care of those who are most vulnerable.
That it will be dumped?
Well, we've said, and we're very clear about this, Medicare is dead if we can't make it sustainable today. The Labor Party will kill Medicare by offering everything to everybody for free, and the government is determined to make Medicare sustainable and strong, not just for today. These are plans which will set up Medicare for the next decade or two. We have had good feedback, good engagement with the independent senators, but we are pragmatic about the Senate, but we are absolutely determined to make Medicare sustainable. So the Labor Party can pretend to the Australian public that things are for free. They can't be for free. We have to pay for a world-class medical system. We will negotiate with the senators. We are pragmatic about the approaches that might be available to us, but we will make Medicare sustainable. We will get money into the Medical Research Future Fund, and we will make sure that we have this sustainability, which will include a price signal.
So the government has not dumped the Medicare co-payment?
Sorry, Lane.
The government has not dumped the Medicare co-payment, or you're going to do it by regulation?
Look, the government is pragmatic about the situation in the Senate. We'll continue negotiations with the senators, but we will look at every option that is available to the government to make sure that we make Medicare sustainable. Labor is intent on killing Medicare through making everything for free, and you will not protect the most vulnerable in this country if you collapse Medicare. You can only protect the most vulnerable people in our country if you have a sustainable health system. There's no sense pretending, like the Labor Party is at the moment, that the Rudd-Gillard government didn't receive the two independent reports that both said that health spending is unsustainable. That is the basis upon which this government set out to make Medicare sustainable. We will not be deviating from that path, and we will be making Medicare stronger for an ageing population with new medical technologies. We're spending almost $10 billion a year on medicines, and I can promise you, coming down the pipeline, we have billions of dollars of additional expenditure on cancer drugs, on rare medicines that we will need to pay for, and if we don't create headroom and we don't create opportunity to spend more on technology in the health space, as well as workforce, people want the latest technology, robotic surgery, all of that needs to be paid for. The Labor Party has its head in the sand at the moment, and we are determined to make Medicare sustainable, and we will do that.